Hearing loss not only affects the person who has hearing loss, but the people around them. Family members, friends, and coworkers will notice a breakdown in communication. Audiologist Dr. Daisy Elwick discusses causes of hearing loss and what to expect from the newest hearing aids.
As an audiologist, I've really seen a lot of variations on why people finally come in. A lot of the time it's a family member or spouse that's just had it. They're frustrated. We've got to do something, at least get it checked out to know what's going on with their hearing.
Dr. Elwick describes the process of matching the patient with a hearing aid.
They come in for a consultation. We take a history just to get a medical background on them. We do a complete examination of their ear, and then we'll put them in a sound booth and we'll conduct a pure tone test, basically to see what sounds they can hear well, where they're having their problems, and then we will make some recommendations based on those findings. Hearing aid fittings are what we say is a science and an art. We program the devices very specifically for the patient's individual ears, so any difference between the right and left ear is accounted for in the hearing aid programming. Sizing is measured accurately so the patient has a good physical fit so that they're comfortable. And then everything is calibrated while the patient's using it so that it's very personalized for them. The process from testing to time of fitting can be done in the same day now. We have products that are readily available. They come off the shelf, and then we plug into them and do the fine-tuning and the programming for the individual. So they can come in essentially the same day they get a test and walk out with a set of hearing aids.
Patients discover a whole new world of hearing and communication.
At that 1-week follow-up, we hear that the patients are noticing that they're hearing more clearly, and not only them, but the family member or the spouse. Notice they don't repeat themselves as much, things aren't getting as confused as before, so it's really something that they enjoy and notice a significant change in. We hear that the patients are hearing the strangest things. To them, they're strange, but actually it's things that have always been in the environment. We hear a lot of, I can hear the birds in my backyard. The big test is really the patient going home and using the device, going to the market, going to the restaurants, and seeing if this is improving and how their situation is helped.
Dr. Elwick reveals the range of patients she sees and the causes of their hearing loss.
So my patients are primarily 50 and older, men and women. We do also see children and younger 40-year-olds, but anybody who's been exposed to noise from loud music or working occupationally in a loud environment, those are our patients. Hearing loss affects everybody at any age. It just really depends on the patient. Loud music is a big factor with hearing loss. Who doesn't love loud music? It's true. The problem with that is it's sound. The louder the sound is, it acts like noise exposure. So listening to a guitar at a very loud level is the same as listening to a semi-truck driving past you. It's noise exposure, and that will degrade your hearing loss. Usually the high tones is what goes, so people will show up with a high frequency hearing loss. What do they do to compensate for that? They turn the music up louder. So that's just more exposure, more assault on your hearing.
Lead guitarist for the group Blood, Sweat, and Tears waited for years to get his hearing tested.
In small clubs, it's terrible. You have a crash cymbal right next to your ear all night. Over and over again. The bass player's rubbing elbows with you, then he's cranked his amp all the way up, so now it's an arms race with the volume controls. And I did this for years and years. I've realized at a certain point that something was wrong. I was saying "what" an awful lot. Many of the times that I would say "what," the speaker would repeat what they said, and I'd say "what" again, because I'd hear them speak, but I just wouldn't get what they said. When I finally decided to go and do something about this and get my first pair of hearing aids, in quite the opposite way that you don't notice the loss because it's incremental and it takes years, many years. From day to day, it's not different. from year to year, it's only a little different. Quite the opposite effect to turn on hearing aids for the first time, because it all comes back like that, fast. Like as soon as the thing comes on, it reminded me what birds sound like. When they first turned them on, I felt foolish for putting it off for so long. At the same time, it was a feeling of euphoria. I wanted to revisit a lot of the music that I used to listen to, because, and current music that I had formulated how it sounds, but I was missing so much of it that there was quite a bit more. It was an absolute epiphany.
Missing out on your life? Dr. Elwick has great advice.
The average time a person with hearing loss realizes it and actually does something about it, meaning getting a test or getting an evaluation or professional consultation, is usually about 7 years. My message is, don't wait. There's no reason to wait. Get the information. Waiting just prolongs it. Hearing is only going to get worse. The sooner, the better.